which passed on the midst of the calm of the doctor. A storm rose and the earth was stirred. Coronavirus that appeared in December 2019 from Hubei province in Wuhan, China. It was ignored until it turned into a deadly epidemic risk. Under all these stressful times, and nurses' surgical steps must be taken in the fight against COVID-19 for effective examination of the patient. To explain COVID-19, the aim of the report to diagnose the COVID-19 virus using CT scan in order to identify several main sections: introduction to the virus, classification of the virus, the effect of the virus on the body, the role of the CT scan in diagnosing the virus, and the last one, to protection from the virus. The introduction talk about the coronavirus and encapsulated RNA viruses that are widely distributed among humans, other mammals, and bears, and causes respiratory, digestive, hepatic, and nerve system diseases. It may cause cardiovascular damage. It is produced with a group of nanostructure proteins. When the RNA-dependent RNA polymers catalyzes the synthesis of viral RNA, and those play a central role in the replication and transcription cycle of COVID-19 virus. Now we move on the classification of the COVID-19. In the past, the classification of the coronavirus was largely based on the serologic reactivity involving the S protein, till it became based on comparative sequence analysis of the reflective protein. The choice of protein and the method used to analyze them have gradually evolved since the start of the century. The virus consists of two main parts of the protein, sheath and genetic materials. Outside the cell, it is a non-living organism whose genes change by reproductive by transcription when it enters the respiratory system by contact and touch. To another stage of the transcription process, it transfer of the ribosome to order him to protect a protein sheath, making it here a bone. Virus affect all the system in the body that causes damage in the cardiovascular system. In the cardiovascular system, the incidence of the cardiovascular symptoms is high, warning to the systemic inflammatory response and immune system disorders. During disease processes, the emission of acute myocardial injury caused by SARS-CoV-2 infection may be related to respirators. When the virus enters the respiratory system by breath and infection droplets, that causes an increase in blood flow in the capillary blood vessels, causes heart muscles fatigue. These symptoms are more severe in patients with CVD, which may be associated with increasing section of respirator in this patient compartment with healthy involved. These symptoms is more in the patient that is more than 60 years. COVID-19 is one of the main viruses that's primarily target of the human respiratory system, but it also has neurological capabilities and can spread from the respiratory system to the central nerve system. The neurological and neurological capabilities of coronavirus in humans have been described. With regard to nasal infection, the coronary artery enters to the central nerve system through the olfactory bulb, causes ammunition and denomination. SARS-CoV-2 has a spike protein surface unit 1 that has a high binding affinity to the human receptor aggregation conversion enzyme 2. The virus traveled on the body and surprised the human in the new symptom in the digestive system. Increasing number of clinical evidence collectivity remained as that a digestive system other than the respiratory system may serve as an alternative pathway to infection when people are in connect or in touch with infected or infected wild animal, or heterogeneous carrier and individual with moderated gastroenteropathy is essential section of interaction including virus attachment, receptor recognition, continuous division, and membrane fusion for full binding to membrane wire respect. Special the cell receptor host CERN protein will convergence to COVID-19 approximately 73% of SARS-CoV-2. Under all this, the difficulties of breathlessness for the patient will learn of the respiratory infection. When the virus spread in the air, and the virus entered the respiratory system and still in the nasal passage, take a long way to enter in the lung. If the virus enters the lung, it can invade tiny air sacs or alveoli. It causes pneumonia. At this point, the lung will become inflamed and it's harder to breathe. Where protein pores appear from the envelope that forms the background as the nucleus of the genetic materials. Once of the correct cell is found, it binds to receptor followed by fusion with the cell membrane. They enter and use the cell transcription machines to create copies of how they are. It forms a transcription of the cell in 3 stages of attack: viral restriction, excise interaction of the immune system, and finally pulmonary destruction. Enter this cell, the immune system recognizes the virus and flown to the lung. The lung tissue became inflamed during normal immune function. The inflammatory process is gradually regulated and limited to the affected area. The immune system risks excessively damaging health tissue. More cells die and infiltrate the lung, increase their obstruction and exacerbating pneumonia. That's all combined between the respiratory system and immune system. After the cries of death that came on the ground, many scientists and doctors took many studies. Perhaps they come to the next of the road. The main screening method for detecting cases of COVID-19 is a test of sequential received polymerase chain reaction (RT-PCR). Its a long stick is inserted into the bottom of the nasal passage to taking a sample from the mucous fluid and analyzes by enlarged it if it is the positive or the negative. This test is the specific and sensitive test. Detection technology is required a way to cross this pandemic, save all kind of detection technologies to save human lives. Radiologists use chest radiography to search for visual indication associated with SARS-CoV-2 viral infection. X-ray is a less sensitive method for detecting COVID-19 lung disease compared to CT scan, with a reported basic X-ray sensitivity of 69. X-ray and CT scan include COVID-19 lung function and stained glass opacity. The MRI is not the ideal way to assess pulmonary opacity, but it is trying to try all the important technologies to accelerate the diagnosis of disease. But it shows the ideal result provided by computerized tomography in all different radiological diagnoses, not fully described but CT scans are important in diagnosis and treatment of lung disease. The first step to follow in diagnosing the patient is to take him to the examination room individually, and the medical staff is far away in another room to prevent communication between the patient and the technicians, with order given to him to lie down on his back and raise his hand to photograph the chest area clearly with taking a deep breath and not to move. And after taking the most accurate picture, a diagnosis is taken to the specialist doctor to diagnose the case with coronavirus. So the lung contains white clear glass ramification in the lung. The different examination for the children. Clinical features of pediatric patients are similar to those of adults, such as fever and cough and shortness of breath and sore throats. Most pediatric patients are of mild type, which records a balance between the risk of radiation and the need to scan the chest X-ray. Pregnancy is a physiology condition that before having chest CT scan. COVID-19, it was necessary to take into account the safety instruction necessary to keep the radiation from the fetus and were instruction to hold breath on the lower part of the abdominal and pelvis were the covered with the lead blanket. To obtain a CT scan, the tube voltage was 120 kV with automatic rental tube adjustments. Now I talk about all advice of a protection for the normal people. First, wearing mask, as we note important role for masks by isolating the respiratory system from external infection, and opposite by preventing the spread of infected couch spray to the atmosphere and thus limiting the spread of the virus by a high rate. The second is hand hygiene includes routine hand washing, washing with water and antimicrobial soaps, cleans hands with antiseptic alcohol-based hand rub, and the last one is the surgical antiseptic. After that, the gloves will be pulled to wear the left hand gloves and the right hand gloves without touching the skin or any other area. Wearing protective socks. There is another type of socks worn after wearing a protective cap. Wearing protective clothes. Protective clothes should not be worn with shoes that are not covered to avoid the virus entering the protective clothes. Wearing the masks that FFP2 or FFP3 that have valve. We press wool over the nose, inhale and exhale to know the stability of the mask on the face and the presence of air. Wearing a high-end glasses must be installed. Wear a cap. Wear a face shield. Wearing a second pair of gloves that are more vulnerable to the virus. We tightly close all sides. When gloves are polluted, they are removed in a careful manner. First, gloves are removed by placing two fingers inside the inner layer of gloves and pulling them out and removing them. Taking care not to touch the inner layer of the gloves. Then, put them in the trash and wash hands after and sterilize. In the conclusion of this report, I would like to make it clear that the virus is like a killer worm, attributing the body and destroying its smallest cell. So, everyone should be safe from it. I hope that I have touched on all this aspect with many thanks for Assistant Lecturer Khadija's supervision to produce this work.